Sometimes science surprises us in ways most don't quite expect. Take this new study on cannabis and diabetes, for example. It turns out that cannabis might just be more beneficial than we've been led to believe. Go figure. People who consume cannabis seem to have healthier responses to inflammation, better control over blood sugar levels, and wait for it, they tend to be more active. These factors combined could lower the risk of developing diabetes. This comes from a new research undertaken in the SONIC trial, longitudinal, oh God, this word, epidemiological.
Epidemiological, yes.
Yep. Epidemiological.
Mm-hmm.
Thanks, guys. That collects data from the same individuals over time. Now let's put this into perspective. In the United States, more than 38 million people have diabetes, and 1 in 5 of them doesn't even know it. The Center for Disease Control emphasizes that ongoing studies focusing on prevention, treatment, and management of diabetes are crucial for public health. Angela Bryan, PhD, a professor and co-director of CU Change at University of Colorado Boulder, found that those inflammatory profiles would improve over the course of 4 weeks, particularly those using a CBD as opposed to THC product. Now, Bryan and her colleagues presented their findings at the 2024 Annual American Diabetes Association 84th Scientific Sessions. Now, what exactly does that mean? In the SONIC study, regular cannabis consumers were typically young, healthy, and physically active, with an average age of 30 and healthy body mass index. They were compared to non-users with similar demographics. Now, while their dietary habits needed work, cannabis consumers excelled in physical activity. The study involved oral glucose tolerance tests to measure insulin sensitivity and assessments of various inflammatory markers. For 4 weeks, participants consumed a cannabis flower product, documenting their use, diet, and physical activity. Eating patterns between users and non-users were similar, though users did consume slightly more salty snacks after 4 weeks. Sorry, guys, I didn't turn my phone off. After 4 weeks, no significant changes in inflammatory markers were found. However, those consuming cannabis had lower levels of inflammatory biomarkers and circulating cytokines compared to non-users. With one exception, the MCP1 protein. MCP1 is a protein that signals white blood cells to areas of inflammation or injury, aiding in the immune response and tissue healing. Numerous studies agree that selected cannabinoids and cannabis terpenes are effective in reducing pain and inflammation. For instance, a 2022 study by GB Sciences found that cannabis compounds with anti-inflammatory properties may be useful in decreasing inflammation associated with a wide range of serious human disorders. With these cannabis compounds potentially have more favorable side effects profiles than the non-steroidal anti-inflammatory drugs. Now, this growing acceptance is evident among athletes and others who suffer from chronic pain. The study showed no chronic effects of cannabis use in insulin sensitivity after controlling for BMI and inflammation. The author did note that the study's limitations include a very healthy sample and inability to use gold standard randomization due to the Schedule I status of cannabis, which continues to stymie cannabis research. Day-to-day behavior differences between users and non-users were minimal. Now, Bryan's other research highlights the public health implications of cannabis legalization. One study found that cannabis use before exercise might enhance your enjoyment and the runner's high, potentially making exercising more appealing, even to those at risk for diabetes. Now, another study indicated that CBD-dominant cannabis forms could reduce acute tension and potentially alleviate long-term anxiety relevant for diabetes and stress. It's fascinating, really. We've got a plant that not only could help control blood sugar and reduce the risk of diabetes, but also makes exercise more enjoyable and reduces anxiety. Yet we still struggle with outdated views and lazy stoner stereotypes that prevent further research. So the next time you hear somebody dismissing cannabis as merely a recreational drug, remember this: there's more to the story, and it's high time we paid attention. Oh, and Wilford Brumley might have had a different catchphrase had he known about this. Instead of diabetes, it might have been telling us to all pass the Mary Jane. I'm Stone Slade, reporting for the High at 9 News.
This is fantastic news, Stone Slade.
I love this news, even in my purple state of Texas, right?
I mean, it's
but the key to this thing, though, man, is controlling the munchies afterwards.
Yes.
I mean, I think more or less about controlling the munchies is controlling what munchies you are consuming.
Well, that's what I mean. That's controlling the munchies,
That's
right?
that's no. You can just have the munchies, and like if you're eating like good healthy snacks, it's
Well, that's what I'm saying. Controlling what you munch on, is that better way to
controlling your
word?
choice of
Control your
snacks. Yeah,
munch.
controlling your choice of snacks. Yes. Yeah.
But
Yeah.
chia seeds and quinoa just doesn't hit the same.
Well,
Yeah.
you know.
What I found, a lot of people know I suffer from gout. Gout is a close cousin to diabetes, and
Is that like hemp and
and-
cannabis?
yeah, it's kind of gout is like the THC-A of diabetes.
Got it.
You know.
Got it.
You got the sugar flat.
For what I've learned over the years is that if you just don't buy Oreos beforehand and you make sure you keep DoorDash the app down while you're smoking, like I don't have many gout attacks at all. It's simple as that.
Mm-hmm.
So, as much as I want to champion this study and everything, this still comes down to the person. You got to control the other things too. It's lowering your blood sugar. That's great. It is helping you control the disease. That's awesome. These people, they also need to control their own inclinations too.
Mm-hmm.
So
I just think that this also is taking the place of alcohol in a lot of cases, and how much sugar is in alcohol and glasses of wine, and that also is a big thing that you're taking all of that sugar from an alcoholic drink. That if you're using cannabis to alleviate that instead, or replace alcohol with cannabis, and that's a big place that big place you can get rid of a lot of sugars as well.
Mm-hmm.
Yeah. Oreos are my fucking weakness.
They're so good.
Oh, so bad.
Good.
If you guys didn't read between the lines on that shit.
I knew there was a racial joke in there, but I just decided to sidestep it.
Hey, man, you want to
You didn't want to take the bait, huh? Yarrow, you're so good at taking bait.
Yeah, no, I was already petting my skunk earlier, so I don't need to be the masturbator and bite. But
Wow.
as a fellow
John, is it steak
sufferer
jar?
of chronic gout, I have chronic gout. It is the
It's the
most
worst, right?
pronounced middle-aged malady that I have suffered with for over 10 years, and it affects everything from I can't play soccer to hiking doesn't sound fun anymore.
Yep,
And so
yep.
I really can relate to this idea that some of us do get these conditions that while they're not fatal, they become a life sentence where we need to take care of them for as long as we're here, and where if we don't take care of them, our quality of life can go drastically down as that pain goes dramatically up. So I appreciate the promise that this article offers. But again, most of these articles talk about more research is needed, and we get these glimmers of hope about sort of the medical and therapeutic benefits of cannabis. But a lot of this information is just so new, and really they haven't cracked the code on all of the benefits of the 150 plus cannabinoids. I hope they do. I hope I can look at somebody and say, hey, I'm medicating.
I'm relieving my
certainly for
gout
pain relief.
with this
Well,
joint.
certainly for pain relief with gout, the only thing that touches that pain for me, Rico, I don't know about you, is opioids, because it's in my fucking
colchicine.
bones.
Colchicine, man. I hate it, and I hate the fact that I have to take it. I hate when you feel it. I don't know if where you get yours, but mine's almost always in my right toe, and you can feel that shit coming like hours before that happened. I'm like, yo, I really don't want to take these fucking pills. I don't want to take these pills, but you have to fucking take those shits. But
I helped my friend completely get rid of his gout just using nutrition.
I thought you were
This was a great conversation because
amputation.
this conversation really leads to like what's going on in America, which is
MSG. This is exactly. It is exactly what I'm saying.
Right now, 60% of children are chronically ill, mostly autoimmune diseases, whereas it used to be under 6% up until the 1980s. The biggest thing is if you go into a grocery store, other than the very walls of meat and produce and dairy for some, all of the rest of that stuff is literally engineered chemicals. All of that stuff is scientifically engineered to hook you, and nearly none of it is nutrition, nearly none of it is food. And this is one of the craziest things I see, and I'm not talking about present company as much as like all of my friend groups and the people I see so many people on Twitter and on social media, and they're talking about the deep state and the government conspiracy to get us, and they're going to enslave us.
Yeah.
The same people that are talking about this are smoking corporate cigarettes, they're eating Doritos, and they're drinking soft drinks. And it's like so many people think that there's some sort of, revolutionary culture warrior while they're literally supporting the very thing that is killing us all unconsciously. And the biggest thing is there's no secret pill for gout or diabetes or any of these conditions. There's no secret pill. The secret is getting up every day and making good choices in food, working out, meditating, eating fruits and vegetables, staying away from sugars, staying away from alcohol, staying away from carbs. And unfortunately, that's it's so hard to everybody wants a pill. We all want to, and myself included, we all fall into this complacency where we want to just live our life. If something goes wrong, we want to have a little bit of magic to just sprinkle in there so we can continue to do what we want. The truth is, like, up to this point in my life, and I've explained this to my kids, like, I missed 80% of the happy hours and the fun shit that my friends were doing because I was working out or learning or training martial arts or yoga or some other movement and mind modality in my life. I missed almost every fucking party. I missed 90% of the parties that happen every weekend because I'm hanging out with my kids, I'm hiking, and I'm going to sleep early. But I feel terrific. I'm in my 50s, and I can outperform most people in their 20s. And real magic pill is dedication and unflinching, unwavering discipline. If anybody ever wants help with this,
I think
down to help everybody
right.
here on the panel, in the chat, and anywhere with nutrition, workout, and all that shit to make you the best you can be.
I agree with you. I agree with you, Matthew.
I don't think anybody disagrees with you, like not one bit. However, Oreos are banging, bro.